wish I knew about biologics for HS a lot sooner. A lot sooner.
I just wish that if I could have started this journey sooner, I wish I would have just kept going.
I actually tried a couple biologics before Cosentyx. And then they were like, hey, Cosentyx was just approved for people with HS. Do you want to try it? And I was like, lay it on me. Because I just wanted relief from the symptoms.
They explained that biologics are formulated to help manage your symptoms. The dermatologist was talking to me about HS, and she said that it is something that is a progressive disease, so we have to manage it while we can, because it is something that does get worse over time, or it can.
I felt like I had already tried so many things that had not worked. Why would I not try one other thing?
So my doctor and I decided it was time to take a biologic right off the bat, because I've already had to have surgery to remove some areas.
If I had to talk to someone who was nervous about starting a biologic, I would tell them to think about all the things that you've already experienced. Think about all the pain you've already went through.
If you're nervous about starting a biologic, do research.
Go get all the opinions you need until you find a solution that works best for you. This is not something that you have to deal with in silence.
I definitely believe advocating for myself got me to a point where I was able to find treatment that worked for me. What I wish I knew about relief being possible is that that was true.
The reality of my treatment with Cosentyx was so much better than I could have ever imagined.
It really put my HS and my HS symptoms in the back burner, and I was able to move forward and move freely in my life.
Indications. Cosentyx, secukinumab, is a prescription medicine used to treat people 6 years of age and older with moderate to severe plaque psoriasis, PSO, that involves large areas or many areas of the body, and who may benefit from taking injections or pills, systemic therapy, or phototherapy, treatment using ultraviolet or UV light alone, or with systemic therapy. People 2 years of age and older with active psoriatic arthritis, PSA, adults with active ankylosing spondylitis, AS, adults with active non-radiographic axial spondyloarthritis, NRAxPA, and objective signs of inflammation. People 4 years of age and older with active enthesitis-related arthritis, ERA, adults with moderate to severe hidradenitis suppurativa, HS. Important safety information. Do not use Cosentyx if you have had a severe allergic reaction to secukinumab or any of the other ingredients in Cosentyx. See the medication guide for a complete list of ingredients. What is the most important information I should know about Cosentyx? Cosentyx is a medicine that affects your immune system. Cosentyx may increase your risk of having serious side effects, such as infections. Cosentyx may lower the ability of your immune system to fight infections and may increase your risk of infections. Some people have had serious infections while taking Cosentyx, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses. Some people have died from these infections. Your doctor should check you for TB before starting treatment with Cosentyx. If your doctor feels that you are at risk for TB, you may be treated with medicine for TB before you begin treatment with Cosentyx and during treatment with Cosentyx. Your doctor should watch you closely for signs and symptoms of TB during treatment with Cosentyx. Do not use Cosentyx if you have an active TB infection. Before starting Cosentyx, tell your doctor if you are being treated for an infection, have an infection that does not go away or that keeps coming back, have TB or have been in close contact with someone with TB, think you have an infection or have symptoms of an infection such as fevers, sweats or chills, muscle aches, cough, shortness of breath, blood in your phlegm, weight loss, warm, red, or painful skin or sores on your body, diarrhea or stomach pain, burning when you urinate, or urinate more often than normal. After starting Cosentyx, call your doctor right away if you have any signs of infection listed above. Do not use Cosentyx if you have any signs of infection, unless you are instructed to by your doctor. What are the possible side effects of Cosentyx? Cosentyx may cause serious side effects, including serious allergic reactions. Serious allergic reactions can occur. Get emergency medical help right away if you get any of the following symptoms: feeling faint, swelling of your face, eyelids, lips, mouth, tongue, or throat, trouble breathing or throat tightness, chest tightness,
Skin rash or hives, red itchy bumps. If you have a severe allergic reaction, do not give another injection of Cosentyx. Inflammatory bowel disease. New cases of inflammatory bowel disease or flare-ups can happen with Cosentyx and can sometimes be serious. If you have inflammatory bowel disease, ulcerative colitis, or Crohn's disease, tell your doctor if you have worsening disease symptoms during treatment with Cosentyx or develop new symptoms of stomach pain or diarrhea. Severe skin reactions that look like eczema can happen during treatment with Cosentyx from days to months after your first dose and can sometimes lead to hospitalization. Your doctor may temporarily stop treatment with Cosentyx if you develop severe skin reactions. Tell your doctor if you have any of the following signs or symptoms: redness or rash, itching, small bumps or patches, your skin is dry or feels like leather, blisters on the hands or feet that ooze or become crusty, or skin peeling. The most common side effects of Cosentyx include cold symptoms, diarrhea, and upper respiratory tract infections. These are not all of the possible side effects of Cosentyx. Call your doctor for medical advice about side effects. Before using Cosentyx, tell your doctor if you have any of the conditions or symptoms listed above for infections. Have inflammatory bowel disease, Crohn's disease, or ulcerative colitis. Are allergic to latex. The needle cap on the Cosentyx Senza-Ready pen and 150 mg per milliliter and 75 mg per 0.5 milliliter pre-filled syringes contains latex. Have recently received or are scheduled to receive an immunization, vaccine. People who take Cosentyx should not receive live vaccines. Children should be brought up to date with all vaccines before starting Cosentyx. Have any other medical conditions and all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Keep a list of your medicines to show your healthcare provider and pharmacist when you get a new medicine. Are pregnant or plan to become pregnant? It is not known if Cosentyx can harm your unborn baby. You and your doctor should decide if you will use Cosentyx. Are breastfeeding or plan to breastfeed? It is not known if Cosentyx passes into your breast milk. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including medication guide.